If you're over 70 and your doctor just celebrated getting your blood pressure down to 120/80, there is something important that needs to be understood before accepting that number as the ultimate goal. For years, this reading has been presented as the gold standard for cardiovascular health, something to strive for at any age. It has been repeated so often that it feels unquestionable. Lower numbers are assumed to mean better health, lower risk, and longer life. But recent evidence is beginning to challenge that belief, especially for older adults whose bodies function very differently than they did decades earlier. A large-scale study that followed more than 15,000 seniors over a period of 5 years revealed findings that surprised even experienced researchers. Instead of confirming that lower blood pressure always leads to better outcomes, the data showed something far more complex. Those who achieved very low blood pressure levels, numbers often praised as ideal, were not necessarily the healthiest group. In fact, they were more likely to experience serious complications, particularly falls that required hospitalization. Even more concerning, their overall survival rates were lower compared to those whose blood pressure remained in a slightly higher range. This creates a difficult but necessary shift in understanding. The idea that lower is always better begins to fall apart when looking closely at how aging changes the body. Blood pressure is not just a number on a screen, it represents the force that keeps blood moving to the brain, the heart, and other vital organs. When that pressure drops too low, especially in an aging system, it can lead to reduced blood flow at critical moments. That reduction may not always be noticeable at first, but over time, it can contribute to dizziness, instability, and a much higher risk of injury. For many older adults, the consequences of a fall go far beyond a temporary setback. A single fall can lead to fractures, surgeries, long recovery periods, and sometimes a permanent loss of independence. This is why the findings from this research carry so much weight. They suggest that aggressively lowering blood pressure without considering age-related changes may unintentionally increase risk instead of reducing it. What makes this even more concerning is how common this situation has become. Standard guidelines are often applied broadly, without enough adjustment for age or individual condition. A number that might be ideal for someone in their 40s or 50s may not provide the same benefits or safety for someone in their 70s or 80s. The body at that stage requires a different balance, one that supports stable circulation rather than simply chasing lower readings. There is also a gap between emerging research and everyday practice. Medical guidelines take time to evolve, and many decisions are still based on older studies that focused primarily on middle-aged adults. As a result, many people continue to be treated according to targets that may not fully reflect what is best for them now. This doesn't mean that lowering blood pressure is unnecessary, but it does mean that the approach needs to be more thoughtful and individualized. Understanding this shift can change how health decisions are approached. Instead of focusing solely on achieving a specific number, the focus becomes maintaining stability, preventing sudden drops, and supporting overall function. It becomes about how the body responds in real-life situations, standing, walking, moving, rather than how it performs in a single-seated measurement. This perspective encourages a more balanced view of health, one that takes into account not just numbers, but outcomes that truly matter, staying mobile, avoiding injury, and maintaining independence. Recognizing that slightly higher blood pressure may sometimes be protective rather than harmful is not about ignoring risks, but about understanding them more completely. In the end, this information highlights the importance of questioning assumptions that may no longer apply. It opens the door to more informed decisions, better conversations, and a clearer understanding of what it really means to protect health in later years. The findings from that large study become even more striking when looked at more closely. Over 15,000 older adults were observed over several years, not in a controlled laboratory setting, but in real-life conditions that reflected how people actually live. These were individuals with a wide range of health backgrounds, some active and independent, others managing chronic conditions like diabetes, heart disease, or reduced mobility. This diversity made the results far more meaningful because they represented what truly happens outside of ideal clinical scenarios. As researchers analyzed the data, a clear pattern began to emerge. Those who maintained very low blood pressure readings, particularly below the commonly praised 120 systolic level, were not experiencing the protective benefits many would expect. Instead, they showed a noticeably higher rate of serious falls. These were not minor slips or harmless stumbles. Many of these incidents resulted in hospital admissions, fractures, and long recovery periods that significantly affected quality of life. The connection between lower blood pressure and increased fall risk may seem surprising at first, but it becomes more understandable when considering how the body responds to sudden changes. In position. When standing up, the body must quickly adjust to maintain blood flow to the brain. If blood pressure is already low, even a small drop can reduce circulation enough to cause dizziness or instability. In younger individuals, the body compensates quickly. In older adults, this response is often slower and less effective, creating a window of vulnerability that can lead to loss of balance. Beyond falls, the study also revealed another important concern. Individuals with very low blood pressure were more likely to experience complications related to reduced blood flow to vital organs. The kidneys, for example, rely on steady pressure to filter waste effectively. When that pressure drops too much, their function can be compromised. Over time, this can lead to acute kidney issues, which further complicate overall health and increase the need for medical intervention. Perhaps the most unexpected finding was related to overall survival. When comparing different groups, those with moderately higher blood pressure, typically in the range of 130 to 140, consistently showed better outcomes. They had fewer hospitalizations, fewer serious complications, and a lower risk of death over the study period. This challenges the long-standing belief that pushing blood pressure as low as possible will always produce the best results. At the same time, it is important to recognize that very high blood pressure still carries well-known risks. Elevated levels can increase the likelihood of heart attacks, strokes, and other cardiovascular problems. The key insight from the research is not that high blood pressure is safe, but that there is an optimal range where the benefits of adequate circulation are balanced against the risks of excessive pressure. This middle range appears to provide the most stability for older adults. It allows the body to maintain consistent blood flow during everyday activities, while reducing the likelihood of sudden drops that can lead to falls. It also supports organ function more effectively than overly aggressive lowering strategies. In many ways, it reflects a shift from chasing ideal numbers to prioritizing real-world outcomes. What makes this information particularly important is how it challenges routine assumptions in healthcare. Many treatment decisions are still guided by targets that were developed using younger populations. While those targets remain valuable in certain contexts, they may not fully apply to individuals in later stages of life. This can lead to situations where treatment is intensified based on numbers alone, without fully considering how the person feels or how their body responds in daily life. Another factor to consider is that blood pressure readings taken in clinical settings do not always reflect typical conditions. Stress, environment, and timing can all influence the numbers recorded during a visit. This means that a single good reading does not necessarily tell the full story. When combined with medication effects, this can sometimes result in blood pressure being lowered more than intended, especially outside of the doctor's office. All of this points to the need for a more individualized approach. Instead of relying solely on standard targets, it becomes essential to consider age, overall health, physical function, and how the body responds to treatment. Monitoring patterns over time, rather than focusing on isolated readings, provides a clearer and more accurate picture. Ultimately, these findings reinforce a simple but powerful idea. The goal is not just to achieve a number, but to maintain stability, safety, and quality of life. For older adults, this often means accepting that slightly higher blood pressure may actually be part of a healthier balance, rather than something that needs to be aggressively corrected. A situation that plays out far more often than most people realize begins with what appears to be a routine and responsible medical decision. An older adult walks into a clinic for a regular checkup, feeling relatively well, managing daily life without major issues. The blood pressure reading comes back slightly elevated, perhaps around 145/86. It's not extreme, not immediately dangerous, but it sits above the commonly accepted target. Based on standard guidelines, the decision is made to bring that number down. Medication is prescribed, sometimes starting with a low dose, with the intention of reducing long-term cardiovascular risk. At first, everything seems to move in the right direction. Follow-up visits show improvement. The numbers begin to fall. 135, then 128, then eventually settling near what is considered ideal. From a clinical perspective, this looks like success. The chart reflects progress, the targets are being met, and the treatment appears effective. T. Here's a sense of reassurance that the risk of heart attack or stroke is being reduced. But outside the clinic, in the flow of everyday life, a different reality can begin to take shape. The body does not function in a static, seated position the way it does during a measurement. It moves, adjusts, reacts to changes in posture and activity. For an older adult, these transitions are especially important. Standing up from a chair, getting out of bed in the morning, walking to another room. These are simple actions, yet they require precise coordination within the cardiovascular system. With blood pressure lowered significantly, these normal movements can start to feel different. There may be a brief moment of lightheadedness when standing. A slight delay before balance feels steady. At first, it might seem insignificant, easy to ignore, or attribute to fatigue or age. But these small signals are often the body's way of indicating that something is not quite aligned. As time passes, these episodes can become more noticeable. Standing up quickly may bring a wave of dizziness. Turning too fast might create a sense of instability. Vision may dim slightly for a second or two. These experiences are not random. They are the result of blood pressure dropping too much during positional changes, reducing the flow of blood to the brain at critical moments. Then comes the moment that changes everything. Perhaps it happens at night when the body is already in a more vulnerable state. Getting up from bed to walk to the bathroom, the sudden shift from lying down to standing causes a rapid drop in pressure. The brain does not receive enough blood flow quickly enough. Balance is lost. There is no time to react. A fall occurs. In that instant, the focus shifts entirely. The conversation is no longer about achieving ideal numbers or meeting guideline targets. It becomes about injury, recovery, and the potential loss of independence. A fractured hip, for example, can lead to surgery, extended hospital stays, and rehabilitation that may last weeks or months. For many older adults, recovery is not always complete. Mobility can be permanently reduced, and the ability to live independently may be affected. What makes this scenario particularly concerning is how easily it can be overlooked. The treatment appears successful when judged by standard measurements. The numbers look good. There are no obvious warning signs during routine visits. Yet the underlying issue, how the body responds to those numbers in real-life conditions, remains unexamined. This highlights a critical gap between clinical targets and functional outcomes. Blood pressure readings taken in a controlled environment do not always capture what happens during daily activities. They do not reveal how the body handles transitions, how quickly it adjusts, or whether the brain is receiving consistent blood flow throughout the day. It also underscores the importance of paying attention to subtle changes. Moments of dizziness, brief instability, or a sense of weakness when standing are not insignificant. They are valuable signals that deserve attention, especially when blood pressure has been recently lowered or medications have been adjusted. The broader lesson is not that treatment is unnecessary, but that it must be carefully balanced. Lowering blood pressure can reduce certain risks, but pushing it too far can introduce new ones. The goal is not perfection on paper, but stability in real life. A number that looks ideal in a clinic may not always translate to safety in motion. Understanding this scenario helps bring clarity to a complex issue. It shows how easily good intentions can lead to unintended consequences when individual differences are not fully considered. And it emphasizes the need to look beyond numbers, focusing instead on how the body functions in the moments that truly matter, standing, walking, and maintaining balance in everyday life.